Yeah, so this is not immune mediated. This is just by basics for the postgraduates, especially on the garden variety of dry eye that you will come across in your practice as soon as you start private practice or as soon as you start seeing patients in OPD. So I call it the ABCDE of dry eye, and how you can diagnose 80% of dry eye patients, the garden variety as I call it, with your ears and not necessarily with any other tools. We know about our tear film layers and how they are not watertight compartments, but there is a free flow of lipids, lip polar and non-polar in the aqueous, so also the mucin. So basically three parts of the tears. And there are a whole host of medical conditions which are associated with dry eye, which we need to know about. So we need to ask patients history, not that we want to prevent them from becoming pregnant or prevent them from having a LASIK. And in Mumbai, 50% of my patients are on antidepressants. Not that we want to take away work from the psychiatrist, but we need to know about these conditions because so many of these can cause dry eye. So I call it the 5 common causes, and I'll rush through them: A, B, C, D, E, where A stands for aging, B stands for blinking, C for contact lenses, D for drugs, and E for environment. So aging, we know that tears are 60% less at age 65 compared to age 18. So imagine a typical elderly cataract operated patients. Why do they develop dry eye? Multiple causes. But part of it we are to blame. We don't accept 160 blood sugar. We say that is almost going to diabetic ketoacidosis. You bring the sugar down by giving all sorts of sulfonylureas and other tablets. The tablets cause dryness in the eye. We don't accept 130 by 90 as blood pressure. No, that's too high, malignant hypertension. We want it down to 100 by 70. We give the patient calcium channel and beta blockers. That causes dry eye. And we load the patient with the oral antibiotics, topical antibiotics, steroids, and all these preservatives cause dry eye. So all our poor cataract patients come to us with a cataract and go away with an irritable eye. Also, many of them have come from the villages where the air is purer, the pollution is less. They come to Mumbai, which is a polluted city, and that can easily cause them to develop dry eye. So you must remember aging as A. B is blinking. We are aware of the computer vision syndrome, where you get not only number of blinks per minute reduces. I remember a colleague of mine, Dr. Ram Mirle, had done about 20 years ago, put a high-speed camera in front of the computer operators and a high-speed camera in front of the telephone operator, who in those days was using those wired things to push in into a switchboard. And she didn't have a computer. And the number of blinks in the computer programmers was about 50% or less. So you're supposed to blink at least 25 times a minute, and they were blinking 10 to 12 times a minute. Also, those blinks are half, they're not complete blinks. If you look at a patient closely when you're chatting with him, just from the history, you'll see that his blink is not full many times, these youngsters. So you need to know about this. And excessive blinking. Some of the children develop a habit, a tic sort of a blinking excessively. That doesn't allow the tears to spread evenly. We reassure the parents. We might give them 0.12 cylinder at 37 degrees because we want to do something. But put them on some tear drops at the same time, it might help. Contact lenses is a given. It increases the tear evaporation, provides a greater surface. So I won't go too much into this. I'll just delve a little into drugs and medications. I hinted on this during your cataract patient who is over medicated. But we need to know that many of our simple cold medicines that we take, most of the patients take medicine for cold, and antacids and antidepressants, diuretics, all these can cause it. Too much of coffee and alcohol can cause it. And a new thing which has come in, our respiratory colleagues have been prescribing CPAP machines left, right, and center for sleep apneas, which is a new fad, as it were. Having said that, I have been using a CPAP machine myself for the last 15 years. But a CPAP machine can also cause dry eye, especially if it is ill-fitting or ill-maintained, because there is air under pressure coming in through that mask, and that if the mask is not fitting well, it tends to go into the eye and cause dryness in the eye. So you need to be aware of the history of CPAP machine as well. Environment is important. Both air conditioners and heaters both do the same thing. Air conditioner in this room, it takes the water out from the room and through pipes throws it down. I live on the 11th floor, so water from my air conditioner falls on a pipe with a pipe onto the 10th floor fellow's balcony, poor chap. So the room doesn't like to be without the water, so room tries to suck the water out from your eye, and therefore you get dryness in the eye. So we need to know this. We need to tell patients to sit with their backs to the air conditioner in an office, and suspect this in an overly rich patient who has got everything right from air conditioned bathrooms to air conditioned cars to air conditioned clubs where he goes. So he's 24/7 in an air conditioned environment. Pollution and dust are well known as well. So the symptoms of dry eye, we need to know again, these are known to us. Fluctuating vision. There are many causes of fluctuating vision. One of them is dryness in the eye. So early keratoconus, yes. Early macular degeneration, yes. The normal tension glaucoma, yes. So all sorts of things are there. But the simplest thing we don't suspect is fluctuating vision due to dryness. If the tear film is not lubricating the cornea, at the time it is not lubricating, patient sees worse. When it is lubricating, patient sees better. He closes his eyes and opens and life is better. So fluctuating vision. And stringy mucus, you see that mucus that over there at the edge over here. So if your waiting room is with patients waiting for 1 hour, he has finished pulling this mucus out. It's like a habit. He pulls it out like people dig their nose. You won't see this. But if you have an empty waiting room where you take the patient in 30 seconds after coming, you'll see this stringy mucus over there, which is a dead giveaway of an aqueous deficient dry eye. In signs, I told you, but these are all the common signs. I won't go into that, sorry. But the sagging conjunctiva, which I alluded to in the morning, look for conjunctivochalasis and you will find it. So to summarize, keep a high index of suspicion. Ask leading questions about work environment, contact lenses, medical conditions, sleep issues. Observe the patient as a whole when they enter the room, the gait, fingers and toes. Is there a malar flush, acne, rosacea? And more than 90% of dry eye patients can be diagnosed with your eyes, ears, with little bit of contribution from your brain as well. Thank you so much for your attention.
Thank you, sir, for the brief but very useful tips on ABCD of dry eye.